ACL tears are a relatively common but very serious sports injury. They occur commonly during cutting and jump landing activities. Deficits in hip strength and neuromuscular control of the knee have been identified as some of the major risk factors for ACL tears. Here are a few drills you can do to reduce the risk for these injuries. This exercise is called the split squat. Place 1 foot forward and 1 foot back, and slowly drop your back knee down to the ground. The objective of this exercise is to do so without letting your front knee cave into the middle. This exercise is called the step down. Stand on a 6-inch step and slowly lower your opposite heel down to the ground and back up. You want to tap your heel but not place any weight on that leg. The objective of this, like the split squat, is to do so without letting the knee cave into the middle. Ankle sprains occur when the foot turns too far inward during weight bearing. They occur commonly during sports like soccer and basketball and can recur very commonly when not treated properly. Deficits in ankle strength and balance are some major risk factors for ankle injuries. Here are some drills you can do to reduce the risk for these injuries. This exercise is called monster walks. Place a light resistance band around the middle of your foot and keep your feet a little wider than your normal stance. Now, while keeping your toes forward, take short steps forward and backward without letting the band pull your feet into the middle or turn your toes inward towards the middle. This is a balance drill to challenge the stability of the ankle. Stand on 1 foot with a slightly bent knee and reach as far forward, to the side, and backwards as you can without losing balance. Alternate sides. The rotator cuff is a group of 4 muscles that stabilizes the shoulder. Injuries to the rotator cuff can either be traumatic from a fall onto the arm or from repetitive stress and strain. Here are some exercises you can do to help keep your shoulders healthy. This is an exercise that can be used to strengthen the muscles of the rotator cuff. Grab a light resistance band, hold your elbows at your sides, bent to 90 degrees, stand tall, and slowly stretch the band to the sides as far as you comfortably can and bring them back to the middle. This is the ITY, and it's a drill used to strengthen the scapular muscles, which can help prevent excessive strain on the rotator cuff. Lay on top of a ball or bench and reach down towards your feet, out to the sides in a T shape, and forwards and overhead in a Y shape. The hamstrings are a group of muscles that runs along the back of the thigh. They're commonly injured during running, sprinting, and jumping. If not rehabilitated properly, they can linger and cause problems for much longer than they should. Here are some exercises to make sure that your hamstrings stay healthy. This is an active hamstring stretch. Lay on your back with your knees bent, grab the back of your knee, and slowly straighten your knee towards the ceiling until a stretch is felt in the back of the thigh. Keep your ankle relaxed or else your calf might limit the stretch. This exercise is a reverse lunge that can help to strengthen the hamstrings after an injury. Try doing this exercise on a hardwood floor or linoleum surface to help reduce the friction. You're going to assume a lunge position and slowly drop down and reach back with your toe pointed. This exercise is called the single leg RDL and is one of the last exercises in the progression before returning to sport after a hamstring injury. Stand on 1 foot, reach back with the opposite foot, and reach forward with your hands, trying to make your body go horizontal like this. Do this slow and controlled through whatever range of motion you can control. Adductor strains, also known as groin strains, are common in sports such as soccer and hockey that have a heavy lateral component. Much like hamstring and ankle injuries, they can be very difficult to rehabilitate and can occur very commonly. Here are some exercises to make sure that your adductor strain goes away. This exercise is called a clamshell. It helps to strengthen the muscles on the outside of the hip, which can help to strengthen the neuromuscular control of the knee. You're going to put your hand on your pelvis, keep your knees bent, stacked on top of one another, and slowly lift your top knee away from the bottom knee. Try to keep your pelvis still as you do this, and use your feet and hip as a pivot point. If you're doing this correctly, you should feel it burn and fatigue on the outside and back of your hip. This exercise is called the bent knee fallout. It's used for restoring neuromuscular control of the adductors after an injury. Lay on your back, tighten your abs, and keep your hands on your pelvis. Slowly lower your leg to the side as far as you can control, and bring it back up. This is a bridge with an adductor squeeze. You're going to take a pillow or small foam roll and place it in between your knees. Tighten your abs, squeeze your glutes, apply pressure to the foam roll, and lift your hips straight up off the table. As you do so, try to keep your abs and back in a straight line and use your glutes to lift up.